Okay, so we have our station today. So Dr. Ruchi is our first volunteer who has ready to take the station.
Okay, ma'am.
Dr. Ruchi, are you there?
Yes, ma'am, I'm here.
Just a second. I'll just start my 2 minutes. Start. Go through the station, and after 2 minutes are done, I will start 10 minutes and then we'll begin.
And only one sheet is there, no?
Yes, no, we have another one.
And next sheet. And next sheet.
You want to go back?
Yes, ma'am.
Okay, 2 minutes up.
Okay, ma'am.
So I'm starting the 10 minutes timer. You can hear me, right?
Yes, ma'am, I can hear you.
Can you switch on your video, or is it okay?
No, ma'am, I can wait.
Because if you switch on, it will be better. Thank you. Okay,
You see,
start.
ma'am?
Yeah.
Hello, I'm Dr. Ruchi, one of the doctor in the clinic today. May I confirm your name and age, please?
Yes, doctor. I'm Gemma Splits, and I'm 25 years of age.
How may I address you?
Gemma is okay.
Okay, Gemma, as I can see, you are here referred by your GP. Is that right?
Yeah, doctor, I'm really very worried. You see, this was a very planned pregnancy, and I really want to get pregnant. I've been trying for 2-3 years now, and this has happened with me 2 times before, and I lost my pregnancy very early, and this is the 3rd time, and it's just they have done the pregnancy test. They did a scan also. The reports they haven't told me yet, but I'm really worried, doctor. I'm really on the verge of breakdown. What is it now?
I'm so sorry to hear that you have to pass through such a difficult situation, but don't worry, we are here to support you throughout your treatment. But before that, I would like to ask you the few questions so can understand your condition in better way, so that we can plan a mutually acceptable agreed management plan for you. How's that sounds to you, Gemma?
Yeah, okay.
Can you tell me when did you have your last periods?
It's been 6-7 weeks back.
6, 7. Have you confirmed your pregnancy with any blood test? Have you done any test?
Yeah, actually today when I came to the emergency, they did that and they said that it was positive. They did a urine test only. They didn't do any blood test.
Have you any discharge or bleeding?
Yeah, it's a brownish discharge that I'm having since last night, but it suddenly became more today morning, and there is a pain also.
Okay. Any nausea, vomiting?
Yeah, I was having that for past 2 weeks, some slight nausea, then vomiting. It has been similar in past 2 experiences also.
Okay. Is it a spontaneous pregnancy, or have you taken any assistance for the pregnancy?
No, doctor, I was already planning. So the midwife gave me some folic acid tablets, which I've been taking for the last 1 to 2 years now, since I'm trying to get pregnant. Nothing else do I take.
Can you tell me more about your previous pregnancies?
It's been last 1 year that I've lost these two pregnancies, and they were also like this. Suddenly there was a bleeding, and then they said did an ultrasound. They did a pregnancy test after 2 weeks, and they said that it has cleared on their own. But there was a pregnancy definitely.
I'm so sorry to hear that. Do you have any medical condition you're seeing your GP?
No, doctor, I have been perfectly fine otherwise.
Any surgery before?
No,
Any family history that bothers you? You would
no,
like.
not really.
Can you tell? Are you aware about your weight and height ratio?
Yeah, it is around 24.
And are you allergic to anything?
No, doctor.
Are you aware about your blood group?
Yeah, it's A positive.
Do you have any blood reservations?
No, nothing.
Do you smoke?
Yeah, I used to, but after my first miscarriage, I have stopped.
Good to know that. And do you take any alcohol?
Occasionally during parties and all, not regularly, doctor.
And pardon me to ask, do you take any kind of fun drugs?
No, no, no.
What do you do for your living?
I'm a school teacher.
Okay. And how's your support at your home?
Oh, my partner is extremely supportive. He's a football coach and he had taken time off in my previous pregnancies as well. He was supposed to come, but he's not here. He's engaged somewhere.
Good to know that you have a nice support at your home. How's you feeling from the last couple of weeks, like down or depressed? Anything like that?
Well, as soon as the pregnancy test comes, I become happy, but this time I'm really anxious. From the date I know that I'm pregnant, I'm anxious, and now with this, I'm really down.
I'm so sorry to hear that. If you would like to, I will connect you with the counselor if you want to talk about that. Is it okay for you?
Yeah, that would be great.
Thank you so much. Thanks for sharing me your information. Now I would like to examine you in the presence of the chaperone, if you allow me. So just I have just have a journal physical examination. Just have a look for your tummy and the examination from down low. Is it okay for you?
Yeah, okay, doctor.
Okay. Gemma, as I have your ultrasound reports with me, and I have confirmed your name and NHS number. But before that, I would like to ask you, do you have anyone by your side or would like to call anyone to discuss the report before that?
No, doctor, it's okay. You can discuss with me. I'm not strong enough, at least to hear.
Okay, Gemma, I don't have a good news for you. I have a report with me, and it shows that there is a pregnancy in the intrauterine, but the baby has not formed properly, and it is not growing properly. And this is condition called a silent miscarriage or a missed miscarriage. Are you getting me?
Again, doctor.
I'm so sorry, Gemma, that you have to go through such a difficult situation. But yes, the scan has shown that the baby hasn't developed.
Oh, God, now what, doctor? Is there no reason, like, is there no test that you can say why it has happened like this?
As I can see, it is your third miscarriage. For that, I would like to be for the treatment. I would like to refer you to the multidisciplinary team and a recurrent pregnancy miscarriage clinic, so they can do the further investigation for that, which might include the genetic testing of the products of the conception, what we are going to pass this time, and if it is sometime is anything is came out to be abnormal in that, it might require the blood investigation for you and for your partner. And other than that, some hormonal tests will be required, and some ultrasound of your womb after the clearance of the pregnancies. And sometimes there is a risk of some blood clotting test might also be required. There are so many causes, but sometimes there no cause has been identified in these conditions. So for that, I would like to refer you for the recurrent miscarriage clinic. Is it okay for you?
Yeah, okay, doctor. And what about now?
For now, as it is not, if the pregnancy is not viable at this time, so we need to end up in this pregnancy, and we have three options for you. either you can opt for the expectant management, which means that the miscarriage will happen. Miscarriage will happen on its own, but it will take a longer period of time. And during that period, you might face the heavy bleeding or the abdominal cramps at that time, and it will take approximately 2 to 3 weeks to clear up. Is it okay, Gemma? Are you following me?
Yeah, okay.
Other than that, you might opt for the medical treatment or the surgical treatment. During the medical treatment, if the patient opts for the medical treatment, you will be provided with some of the pills, some tablets, which will speeden up the natural course. And during this course of treatment, you might have faced the heavy bleeding and some abdominal cramp. And it doesn't, but advantage is that you don't need any kind of the anesthesia. And some women may find out it a preferable method over the surgery. Okay, Gemma?
Okay.
And the last resort is the surgical method, which is the faster and the quicker method, but it requires the interventions with the help of some instrument, and it may be done by putting you under the sleep, or by putting the area, or by the local anesthesia, by putting the area below low down, by putting it numb. And it is just a daycare procedure in which operation is being done by removal of the products of conceptions. Am I clear so far, Gemma?
Yeah, sure, doctor.
But during whenever we are opting for the surgical treatment for the clearing of the womb, it might associate with some risk, which is include the bleeding. That is, 1 in 100 women might have a heavy bleeding and may require the blood transfusion. And some women, in 1 in out of 10, may have an infection, and certain and sometime may require that there is certain time of the risk of retained product of conception will be there, and there is a rare risk of the perforation is also being there in some situations. Am I clear so far, Gemma?
Okay.
Okay. What about your thoughts about this? What you want to offer for that?
I will wait, doctor. This is too much for me, but I don't want to go under surgery. What if my next pregnancy chances are reduced?
Okay, Gemma, I will provide you all the documents, all the information in the form of the information leaflet, so you can go through with that, and we'll connect you with the clinic with my consultant and write it back to your GP, and note down in your clinical notes. Once you will be decided of what further you want to go for that, and you can book an appointment for further for this for your treatment. Is it okay for you?
Okay, doctor.
Is there any other concern would you like to address me today?
Yeah, your time is up. Okay, you can finish it.
Yeah, finished.
No, it's okay. You were done very well. Just a bit. You have done a lot, very well, I must say. It's just that 10 seconds more you went, but a little bit here and there. You, what do you think? Tell me. You must be. What are the things you missed? You said almost everything. See, starting from information, you gathered all information. Patient safety, you asked me my blood group, my allergy, previous history of miscarriage you got through, my occupation, you took history of my addiction. But tea and coffee thing also you need to ask, like recurrent miscarriage, just like habit wise, because not for all tea and coffee is not required. Because your recurrent miscarriage, just go through tea and coffee, because when you will come for management, then you have to say, I would suggest you would reduce your tea intake or coffee intake if she is taking it regularly. That way you can say. It's a minor thing, just keep in tab. Then for information gathering, you came to my medical history, surgical history also, you didn't mention separately, but you can ask any surgeries on your tummy and below. That is a good line that you can use. Or you can say from your belly button and below. Sometimes you can use that. That comes under surgical. Family history, you did ask, like any similar history in the family or not. Yes, STIs, you need to signpost. And always, you did signpost for, again, you need to, for STIs, you need to ask, if you're, is it okay if I ask you a few personal questions? Then you can go ahead with STI screening, right? Anytime you have suffered from any sexually transmitted infection. Okay. So that is one thing you missed. Then coming to management, it was good. But management, before going for recurrent miscarriage clinic, first you have to manage her situation. You did manage that, but first would be that, then future planning, right? First, you said both the things, but the first thing was her now managing the miscarriage now. You explained expectant, medical, surgically, everything is okay, but you have to manage it now, and then you will say, okay, and you're further when I'm too much worried because I'm too much worried, and I will say, and then you didn't explain me the ultrasound report. So see, first you were repeatedly asking me whether my pregnancy test, see the things which are mentioned, like here it is already written, urine pregnancy test done today came positive. Don't ask the same things which are written. And one more thing, the last thing was ultrasound. I see your ultrasound report, and see, based on your ultrasound report, and your report does not show, you did say that the baby is not there. Yeah, sorry. You did say the baby. First, you need to manage your this current miscarriage that you rightfully said, and then you will manage about the recurrent, referring her to the recurrent miscarriage clinic. And support groups, you also said about counselors, but at the end, what you need to, I'll write back to the GP, and I will put an appointment with my consultant. Mention that I'll put an appointment with my consultant, and I will refer you to some support groups where women who have undergone similar situation like you are going through. So how they are coping with the situation, you will understand better. That is a very important line. And one more thing in between, while you were saying, you were repeatedly telling that term patients are undergoing this, patient needs anesthesia, and anesthesia is, don't say directly anesthesia, say you wouldn't need to be put to sleep. For medical management, you don't need to you need not be put to sleep. For surgical management, you might need some medicines where specialist doctor who will put you to sleep. So that is something, those are medicines come with certain risks, but with your management just monitoring you, taking nature take its own course. Expected management, you can say just a line, allowing nature to take its own course. In one line you will finish off. And I think you did not mention, like, repeating beta HCG after 3 weeks. Your pregnancy hormone would be repeated, either expectant or medical.
Yes, ma'am. After 2 to 3 weeks, you have to repeat.
Don't say 2 to 3, it is 3 weeks. Recent PIL and recent guideline says 3 weeks. PIL, go through the recent PILs. Recent, there are 2 PILs. One is early miscarriage, one is recurrent miscarriage. Both has PILs. So it is written 3 weeks. 3 weeks from the stopping of your bleeding and stopping of your pain. Okay.
Yeah.
Any doubts here? And there is a support group of Tommies and SANs. They are both used in miscarriage as well as in intrauterine death. So they are common. If just remember, in exam, we all forget support groups. We will not remember. Don't say a wrong support group. If you are very sure, only then put a name. But mention, you will be given I will refer you to a support group where women suffering through similar condition as yours are going through. Okay. All right. So thank you very much. You were just bang on in time. Just a few more practice and you will be okay. So yes, you took a good history, all notes, pregnancy test, comprehensive history. You took the results of ultrasound. You broke a bad news. You were considerate, empathetic. You asked for support, whether she needs someone to be with her. Then you referred for recurrent miscarriage clinic, follow-up of investigations, communication with colleagues. Yes, you mentioned about the anesthetist. You mentioned about the products would be tested, specialist clinic, recurrent miscarriage clinic, and writing back to the GP. Patient safety, you confirmed the identity, safe prescription, you took allergy history, confidentiality is always mentioned. And you have followed the guidelines as the management of miscarriage has expected, medical and surgical.